Now we want to look at two categories of drugs three, all right, categories of drugs that act on the central nervous system. So this one is just define them, talk about how they act, and list examples. We'll come back later on and talk about their pharmacologies, okay, better on. So we'll talk about drugs called analgesics, we'll talk about drugs called antiemetics, we'll talk about drugs called antipyretics. Okay, so let me just give you guys a summary before we go in. Analgesics is any drug that will actually relieve you of pain. Antiemetics is any drug that will actually stop you from vomiting. Then antipyretics is basically any drug that is against fever. Okay, so let's start with analgesics. Okay, so analgesics, we said that, okay, but introduction, they are actually broad categories of drugs. They are used in clinical practice. So we are looking at them because we are currently looking at drugs that basically act on the central nervous system, right? So analgesics, we say that they are drugs that relieve pain without causing loss of consciousness. We have different types like the non-opioid analgesics, okay, paracetamol, acetaminophen. Paracetamol is also known as acetaminophen, right? Then NSAIDs like ibuprofen, aspirin. And we have the opioid analgesics like morphine, codeine, fentanyl, okay, and the rest of it. So how do they do? They basically attack enzymes that lead to production of prostaglandins. That's the cyclooxygenase enzymes. We have the cyclooxygenase enzyme 1, we have the cyclooxygenase enzyme 2. So when you attack those enzymes, you basically decrease, okay, or reduce the production of the prostaglandins. Okay, then the opioids, we have the ones that bind to the opioid receptors. How about antipyretics? Okay, antiemetics first. Okay, this is I didn't bring a picture of antiemetics. Just know that antiemetics, they stop vomiting, right? So this one, we say that they prevent or they treat nausea and vomiting. So straight up to examples, we have, don't worry, we'll come back and talk about each of this drug. Okay, we have the dopamine receptor antagonists, like all those metoclopramide, prochlorperazine. Okay, we have serotonin receptor antagonists, all those ondansetron, the granisetron. We have the histamine H1 receptor antagonists, like the promethazine, the diphenhydramine. We have the muscarinic antagonists, or the scopolamine. Also have neurokinin receptor antagonists. So that they block neurotransmitters in the vomiting center or the chemoreceptor trigger zone, okay, of the brain. So have antipyretics, so that those drugs, those ones, they basically lower blood temperatures that have gone high. So drugs like paracetamols, aspirin, ibuprofen. So basically they reduce production of prostaglandins, okay? They reduce production of prostaglandins. So this is just an introduction to these drugs as three categories of drugs that could basically act on the body. We'll come back and talk in depth on them again. We'll pick it one, then later we'll pick sub classifications under the drugs, then examples like that.